Why are we more likely to suffer from dehydration as we get older? My name's Jennie Wilson. I'm a professor at University of West London in the Richard Wells Research Centre. Older people are more likely to suffer from dehydration for a number of reasons. As we get older, our thirst reflex declines, so we tend to find that older people tend to not realise they're thirsty because they don't have that automatic recognition that you would have as a younger person. In addition, many older people are physically impaired or they may be cognitively impaired, which means that they're not so likely to recognise that they're thirsty or they find difficulty in getting access to fluids. What we observed was that you could see peaks in bloodstream infections that occurred in the summer months. And the main cause of these bloodstream infections caused by this specific pathogen was urinary tract infection. In our research, we adopted what's called a service improvement strategy. So that meant that we worked directly with staff who helped design the interventions that they thought were most likely to work. And then we worked together with them to test those, measure their effect, and demonstrate that we could produce a set of practical solutions to improving fluid intake of care home residents. Once we had tested out lots of different methods of trying to improve hydration of residents, we identified the most effective approaches and we put those together in a resource pack, and it's called the I-Hydrate resource pack. It's specifically aimed for care home staff so that it gives them practical information on how to train their staff about the importance of hydration. And subsequent to that, we've also translated that information in that resource kit into an app that you can use in a digital format. Since we finished the project, many homes and indeed hospitals and other settings have adopted our resources. So we do have a number of places that have found them really useful in changing practice and increasing the amount of fluid that older people are offered.